Hello everyone, please come up with your queries. Hello Rachna, please come up with your queries. "44". So it's question number 44, 45 and 40. Let's first take 45. Contraception in a recent delivered. 10 minutes back the lady has delivered and the lady is lactating. What is the contraception of choice? So answer to question number 45 is copper tea. Okay, as you all know that copper tea is put in a female at following times: post placental, right? Post placental. What are the ideal times to put copper tea? Number one is post placental. That is what this was asked in this question, that post placental. 10 minutes back means post placental. Have you got, Rachna? Answer to question number 45. The ideal time for, now let's take another. We cannot give OCP pills. Injection DMPA is to be got after is to be given after 2 weeks, and safe period is not a reliable, right? So answer to question number 45 is copper tea. Next, your question was 44. The drugs which interfere with efficacy of combined oral contraceptive and increase the failure rate. So question number 44 is the drugs which interfere. So all the enzyme inducers, they interfere. Okay. So what are enzyme inducers? All the epileptic drugs, except valproate and clonazepam. Have you got this, Rachna? And the other drugs which can interfere is rifampicin. Okay, rifampicin, ritonavir, the antivirals, grisofulvin. Okay, have you got this, Rachna? Have you got this? Okay, so your next question was 42. All are mode of functioning of combined oral contraceptive pills. So let's discuss what is how combined oral contraceptive pills they function. When we give in combined oral contraceptive pills, we give estrogen and progesterone both. These estrogen and progesterone, they come into the blood, and when they reach hypothalamus, they suppress the HPO axis. Okay, on what is the function on hypothalamus? They suppress the HPO axis. So no release of gonadotropin releasing hormone. Beta, Rachna, I have told you in the question it was except. It was except. Rachna, is it clear to you? In the question it was except. All interfere except. So that is why valproate was there. So as it is written on the slide also, that all epileptic drugs interfere except valproate and clonazepam. Okay. So we were on the mode of action of combined oral contraceptive pill. So combined oral contraceptive pills, they act on hypothalamus and they suppress the HPO axis. When they suppress the HPO axis, they decrease the release of FSH and they decrease the release of LH. When they decrease the release of FSH, so there is no stimulation of the follicle. Okay, and when they decrease the release of the LH, they inhibit ovulation. Right? Now, what is the action on fallopian tubes? Okay, as I already told you that combined oral contraceptive pills contain estrogen and progesterone both, but as the amount of estrogen is less than the natural estrogen which was produced in our body, so the predominant action is that of the progesterone. The predominant action when we take combined oral contraceptive pill is of progesterone. So progesterone decrease the motility. So progesterone decrease the motility. So combined oral contraceptive pills, they also decrease the motility. Number C is cervix. Progesterone make the mucus thick. So they also makes the mucus thick. And number D is on endometrium. So as I told you, the estrogen is less. So the endometrium thinning is there with the use of combined oral contraceptive pill. Okay, endometrial thinning is there. So A option, we are talking here of question number 42. So A option is right, inhibition of ovulation. Okay, B, prevention of fertilization is right. When there will be no ovulation, so fertilization will be prevented. Number 3, interference of implantation. It is right because endometrium is thin, so interference with implantation. So answer is D, interference with placental functioning. No problem in that. Okay, is it clear to you? Rachna, is it clear to you? Okay, let's take the another query. Sumit is saying question number 40. Which of the following contraception has the lowest pregnancy rate? See, let's discuss the Pearl's index. Pearl's index is equals to contraception failure. More is the pregnancy, more is the contraception failure. The lowest Pearl index is of imiplanon, which is a progesterone implant. Yes, Dr. Sumit, it is less than tubectomy and vasectomy also. It is 0.05. It is 0.05. Is it clear to you? Let us see the another. The Pearl's index of tubectomy is 0.2. The Pearl's index of vasectomy is 0.1. Okay, and this is also the Pearl's index of Mirena. So you can see the maximum efficient. This question can also be asked in this manner. The most efficient contraception method is. So the answer will be imiplanon. Okay. Okay. Is it clear to you, Dr. Sumit? Please reply. 22nd. Karishma, you are asking 22nd. If OCP causes psychiatric symptoms and abdominal pain in the patient, the diagnosis is, see, it is, we are taking the 22nd question. If OCP causes psychiatric symptoms and abdominal pain. So as you all know that estrogen and progesterone, they are metabolized in the liver. The patients with acute intermittent porphyria, they have a problem in the liver. So that is why their symptoms are precipitated. It's just a simple thought, right? Is it okay, Karishma? Many of you were asked question number 2. Let me see what it is. Question number 2. Question number 2 is, okay, this question has been asked many times. 28 years old lady delivered 18 months back and is lactating. So first of all, combined oral contraceptive pills, they are contraindicated in lactation only up to 6 months. After 6 months, they are not contraindicated. After 6 months, they don't interfere with lactation. Okay? And that lady also had irregular and heavy periods. So the problem will also be solved by combined oral contraceptive pills. Combined oral contraceptive pills are contraindicated only for first 6 months in lactation. After that, combined oral contraceptive pills, once lactation is established, it does not interfere. Is it okay to you? Hindu Pravalika, is it okay to you? Dr. Aarti, you have also asked. Okay? So let's take the next question. Number 5. See, combined oral contraceptive pills, when should they be advised? So this is a question on mixed pill, right? Combined oral contraceptive pills. Yes, question number 5. Combined oral contraceptive pills. So they should be started on day 1 to day 4. What is the advantage of starting this pill at this time? Then their effect is immediate. Okay? But what if this pill is not started from day 1 to day 4? Okay? For example, if a patient comes to you at day 10, then these pills will not be effective. These pills will be effective, but it takes 7 days. It takes 7 days for the contraception action to come. Okay? It takes 7 days for the contraception action to come. Right? So, if once a new effect of contraception has to come, then it takes 7 days. And for example, if their pills are missed, a effect has been established, but then the pills are missed, then the contraception effect goes in. Then the contraception effect goes in 2 days. Okay? So if one pill is missed, there is no problem. And if more pills are missed, more than 2 or more than 2 pills are missed, then contraception effect goes. And new effect comes in 7 days. Okay? As in this question, at different times, the effect was missed. Okay? So the pills were missed, 4 pills were missed. So it is expected that the contraception effect has gone. Now the lady has to take regular pills for regular pills, and for 7 days it will take 7 days. So the lady has to take contraception, another method, barrier, additional contraception for the 7 days. Is it clear to you? And other than this, we can also do something. If the pills are missed in the first week, if 2 or more than 2 pills are missed in first week, then emergency contraception should be taken. Other than the 2 things, and if the pills are missed in the second week, okay, then nothing is to be done other than those 2. And if the pills are missed in third week, then one has to omit the pill free period. Okay, this contraception is very important. Now another has asked, Dr. Hassan, you have asked most effective contraception is, right? Most effective contraception is question number 3. Okay, as I already told you that most effective contraception is imiplanon. Its Pearl index is 0.05. Then comes vasectomy. Its Pearl index is 0.1, right? And tubectomy Pearl's index is 0.2, which is equals to Mirena. Now comes the combined oral contraceptive pills. Its Pearl index is 0.5, right? And Cocp Pearl's index is 0.622. Okay, so now you tell me which is the most effective contraception. It is combined oral contraceptive pill. The Pearl's index of condom is 16 and spermicide is 12. Okay, is it clear to you? Hitesh, Dr. Hassan, is it clear to you? Let's take now 39 number question. Question number 39. Cocp was, a patient has come for Cocp removal and the thread was misplaced. Ultrasound was done. So when there is missing thread, then there can be 3 options. Either the Cocp has been expelled, right? Cocp has been expelled. Number 2, it is in uterus and the thread has breaked. In uterus and thread broke, or it has gone in perforated and gone in the peritoneal cavity. Right? If it is expelled, so one needs to take the another if it is expelled, then no worries, another Cocp is to be inserted. If it is in uterus, then the method which we use to remove is Cocp hook along with ultrasound, right? If it is in the peritoneal cavity, then we do laparoscopy. We don't do laparotomy. We do laparotomy only in emergencies. Okay, the Cocp perforated in peritoneum is not an emergency. Is it okay? Is it okay, Sumit? Yadav, Dr. Sumit, is it okay? Ramya, you have also asked, is it okay? Ramya, satisfied? Ramya, concept is clear to you? If the copper-T is in the uterus, then we have to remove by ultrasound guided copper-T, and if it is in the peritoneal cavity, then we have to remove with laparoscopy. Okay. Many of you have asked question number 3 also. Is it okay to you? Question Dr. Robin? Okay, next question is 2:16:27. 2 we have discussed. Let's take 16. Ramya, your question is 16. Question number 16 is if the copper-T is there and intrauterine pregnancy has occurred, then why we prefer to take the copper-T out? Okay, because the copper-T in situ act as foreign body and it increases the uterine contraction and causes is preterm labor pain. Okay, so copper-T in situ, it act as in situ, or you can say in uterus, acts as foreign body. So in order to expel that, the uterus contracts and there are preterm labor pains. Moreover, this foreign body is a source of inflammation. You remember copper-T causes aseptic inflammation, so chances of sepsis are there. Okay, Ramya? Dr. Ramya, is it okay? Okay, then next is after 16:27. Not an absolute contraindication for combined oral contraceptive pills. Okay. 27 number question. I already tell you that combined oral contraceptive pills, they contain estrogen and progesterone. Estrogen increases the coagulation factor, coagulation tendencies. So estrogen is not given in the cases of endothelial damage. You all know that Virchow triads has 3 components: endothelial damage, stasis, and increase coagulation tendency. Right? So endothelial damage is in hypertension more than 160/100, not in every hypertension. Okay, diabetes mellitus with vasculopathy, smokers age more than 35 and more than 15 cigarettes per day, and last is migraine with aura. Blood flow stasis occurs in heart diseases, right? And increased coagulation tendencies are seen in the patients who have thrombophilia and postpartum. Thrombophilia tendencies, hereditary or inborn. Other than these, the contraindication are lactation and liver failure, acute liver failure. Okay, is it clear to you? Is it clear to you, Ramya? Question number 27 is clear. So the answer here is diabetes. Right? Let me take your next question. (35) and 39. Wrong about copper tea. So copper tea bitter does not affect fertility. Copper tea does not affect fertility. Let's take the other option. Prevent implantation of fertilized ovum. Yes, it is right. Copper tea prevents implantation of fertilized ovum. That is, it's right. What is the failure rate of copper tea? It is 0.622. Okay. Following removal, fertility reduces. There is no effect, Ramya. Can be used in emergency contraceptive. It is right. Your last question, Ramya, is 39. 39 has been discussed. Any other question? Any other question? Queries are solved. Let us see. Kritika, please explain about which IUCD belongs to which, what kind of generation, and in what cases we have to remove IUCD, and in what cases we can leave during the pregnancy. Okay. So, this is a Kritika question. So, there are what kind of generation and in what cases. So, IUCD generations. Kritika has asked IUCD generation. So, one IUCD generation are first generation are simple IUCDs without copper. Okay. And it contains mainly Lippi's loop. Okay. Second generation contains copper IUCDs. Third generation contains hormonal, any hormonal. So usually they are progesterone IUCDs. Now your next question was what cases we have to remove IUCD and in what cases we can leave. Only the cases in which the thread is, if intrauterine pregnancy occurs with copper T, then only that copper T will be removed whose thread is visible at os. Whose thread is visible at os. Is it okay? Kritika, is it okay? Hindu Pravalika, you are asking why not progesterate? Progesterate has been banned. Progesterate has been banned. Progesterate has been banned in 2003. Okay. Sumit, your question is question number 29. Mode of action of IUCD, right? Copper T act as a foreign body and it causes aseptic inflammation, right? Aseptic inflammation. So it is toxic to so it is toxic to sperm. This copper is toxic to sperm. Have you got, Sumit? Because it is toxic to sperm, it inhibits its fertilization. Because it causes aseptic inflammation, so it inhibits implantation and thereby causes endometrial changes. Is it clear to you? Next, your question is 25. Use of COCP is associated with protection of all the malignancies. Now let us see which malignancies are protected by COCPs. COCP contains estrogen, which is very less than as compared to the natural estrogen which is produced in a female body. Okay, the estrogen which is produced given in the COCP is very less as that of the external estrogen which a COCP pill woman is taking. So all due to decreased estrogen, the estrogenic cancers are prevented. Ovarian cancer risk factor is ovulation. No ovulation, so ovarian cancers are prevented, right? Uterine sarcoma is the fibroid which has changed into the sarcoma, because fibroid is also a high estrogenic condition. So as fibroid is prevented, so sarcoma will also be prevented. Endometrial carcinoma is also a estrogenic cancer, so that is why the endometrial carcinoma is also prevented. It has no effect on carcinoma cervix. Okay, I took the wrong question. I think it was 25. So 25 is solved already, right? We will not give COCP in breastfeeding, DVT, active viral hepatitis. Asthma is not a contraindication. Is it okay? Question number 21. Okay, now there are 4 generation of combined oral contraceptive pills on the basis of, we are taking here question number 21. Okay, so there are 4 generation of COCPs on the basis of estrogen. On the basis of estrogen, there are 4 generations. So first, second and third generation, they are testosterone derivatives. Testosterone derivatives. Because first generation will not to be asked to you, so I will tell you the name of the second generation, levonorgestrel, and third generation is desogestrel. So why are this generation wise categorization? Because the first generation has, because these were testosterone derivatives, they have more androgenic side effects. Second generation has relatively less and third generation has very less. Okay, so that was what it was asked. Third generation or COCP pills have more lipid friendly. Let's take the second option, decreases the risk of DVT. DVT risk is dependent on the estrogen. Okay, these are 4 generation of COCP on the basis of progesterone. Okay, on the basis of progesterone. Okay, so DVT component is due to the estrogen component, not due to the yes. Okay, next is increased risk of breakthrough bleeding. Breakthrough bleeding is same in all of them. Are not used for emergency contraception. They can be used. So more are the testosterone side effects, right? The first generation. Second generation, less testosterone side effect. Third generation, very less testosterone side effect. Have you got it? Sumit, have you got it? 21 number question. 37. Why COPs is wrong? G2P1 who does not want to conceive after abortion. What is the preferred? Beta, first of all, they have not asked you, uh, Isra, they have not asked you what is wrong. They have asked you after abortion. After abortion, always IUCDs is the preferred mode. After placenta removal, after COCPs, because why IUCDs, why COC is wrong? We can give COC, but COC will be given once the coagulation factors which increase during the pregnancy, they settle down after 6 weeks. Okay, post delivery or post abortion, immediately we cannot give, because in pregnancy coagulation factors increase. Once the coagulation factor settles down, then only we can give COCPs. Ma'am, 27 open is wrong in quiz. Let me see. What is wrong in quiz, beta? Sumit, write in detail. Not an absolute contraindication for COCP. It is right, diabetes with vasculopathy. Option is wrong in quiz 27. Which option is wrong, beta? Which option is wrong? Rest all. Number 1, you think it is more than 18 cigarettes? Slight variation can occur. Okay, slight variation can occur. We are not here to see. This is a question of NEET PG 2016. Okay, we are not here to see. Yes, that is why. Yes, that is why it is not an absolute contraindication. That is why it is the correct option. It was asked, Sumit, ki all are absolute contraindication, which is not. That is why we take diabetes. If it would have been diabetes with vasculopathy, then how would we take the answer? Have you got, Sumit? The question in the 27 was not an absolute contraindication of pills. Okay, you have got it. Should we close the session?